Halifax-Armdale.
Thank you, Madam Speaker. Madam Speaker, the Premier recently told the House about a family who moved to Nova Scotia and got a family doctor in just 3 months. It's a great story, but it doesn't really match with what Nova Scotians are experiencing. One family reached out to us after this because they've been waiting since 2021 for a family doctor, which they need for medical reasons. That's over 4 or 5 years without a physician who knows their complex medical history. My question to the minister is, how does one get a family doctor in 3 months while others are waiting for years? How does that happen?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So certainly one of the ways in which that would happen is that there are certain communities that have more physicians or more nurse practitioners in their area. Sometimes wait lists are very small. Certainly we look at Clare and Digby, and that's a success story that's incredible across this province. I think they're at 100% attachment in that area. Whereas we may have other places that we continue to recruit to vacant positions. So anyone that is on the Need Family Practice Registry, first of all, they should make sure that they are there, that their health information is updated, and folks either through 811 or through the website can help individuals navigate to access the care that they require until permanent attachment is achieved.
I recognize the Honourable Member for Halifax-Armdale.
Madam Speaker, one member of this family has a very complex chronic health problem, which they specifically need a family doctor or a nurse practitioner. The longer the wait, the more stress and worry grows. They have no way of knowing how long they will be until they get a family doctor or a nurse practitioner in their community, the type of care they need. When they call for an update, they only get information they're on the list. There are tens of thousands of Nova Scotians in this position. My question to the minister is 5 years or more reasonable, and if not, are there targets set for someone in this family's position that may set so they will receive a family doctor, and what are those target times?
I recognize the Honourable Minister of Health and Wellness.
As I've said in the House before, anyone that is waiting for permanent attachment should make sure they're registered with 811. There's unlimited virtual care. If that virtual care provider thinks that that individual needs to be seen either for episodic care or longer-term follow-up, they can be referred to one of the 19 primary care clinics across this province for inpatient care with team-based care. Those individuals can be followed for extended periods of time if it's required, especially if they have complex healthcare needs, until permanent attachment is achieved. So if there is an individual that has complex care needs, they should make sure that their file is updated and talk to the primary care provider virtually, who will then refer them to a primary care clinic in-person care.